Good morning, and welcome to another episode of A Conversation with Father Orsi. I'm BC Cloutier, Chairman of Action for Life, and this is Father Michael Orsi. Hello there.
Hello, my friend.
How are you?
Yeah, I'm good. You know, BC, I've been thinking, folks have gotten used to this kind of new scenery.
Uh-huh.
Right?
Yep.
I mean, maybe we should give them an opportunity to comment on it.
You know what? Tell us what you think. You can email me. I won't give you Father's email address. He's got enough aggravation already. You can email me, bc@actionforlife.org, and tell us if you like it or don't like it or don't care, whatever.
Yeah, let us know.
We'd love to hear from you. And also, any other comments you have about the show, we'd be delighted.
Yeah, but if you're a nut, don't bother us.
Yeah, because we have each other, you know? Hey, Father, last week we were talking about vaccines. We weren't really talking about vaccines. We were talking about the COVID epidemic and all of the issues that went with it. But that's a nice segue into vaccines. Mm-hmm. And first of all, it should be said that the Catholic Church and virtually all Christian denominations are in favor of vaccination. They believe it's an ethical and responsible choice. And yet there are people who are opposed to vaccines. And, you know, that is everybody's prerogative. The church's position is based on several biblical references. One of them is Philippians 2:4 says, "Look not only to your own interests, but also to the interests of others." It's a call to action to be humble and selfless and to value others above ourselves, which is probably a reason to get vaccinated. Now, we know how our new Secretary of Health and Human Services, Robert Kennedy Jr., feels about vaccines, although he's moderated that position somewhat. And as we're taping this show, there's a serious measles outbreak in Texas that has appeared in Miami.
Sure.
So there's a lot going on with vaccines. I'm going to cite one other statistic that's kind of boring, but it really isn't. The measles vaccine, there are about 1 to 3 per 1,000 measles cases where there's a reaction. With COVID-19, there's about a 1 to 3 per 100. So 1,000 for measles, 100 for COVID. And
that's what we talked about, though, that it really wasn't tested by the usual standards for testing, FDA standards for testing, and NIH.
Right.
Yeah.
So it's, the pendulum swings both ways, right? And now the pendulum, in my opinion, is swinging a little bit away from where it should be. I mean, some of these vaccines are effective, have been proven to be effective. MMR being one, measles, mumps, and rubella. Although, I don't know about you, Father, as a child, I did not have rubella, but I had measles and mumps. And, you know, I did just fine. I mean,
Didn't they call rubella German measles? Didn't they?
I guess that's probably right, huh?
Yeah. But I mean, I had them all. I mean, I didn't want to get cheated out of anything. I had them all. But we do have, let me just be clear about this. We do have a moral obligation to society. We talk about Catholic social teaching. We talk about the dignity of the person. Very important to have to respect the integrity, bodily integrity of the person. But we also have to take into consideration the common good, the good of other people in society. Now, when it comes to vaccines, some of them have proven to be extremely efficacious. In other words, it means they've worked.
Polio.
Exactly. Polio, I could remember as a boy, there would be people, I was born in 1950, and the polio crisis was in the late 40s, early 50s.
My brother had polio. He was 9 years older than me, and my parents, because I was an infant, my parents sent my brother away to a home for boys that had polio.
Yeah, and Franklin Roosevelt had polio, and he got it later in life. It wasn't that he got it as a child. Now, thank God Dr. Salk developed the polio vaccine, but I can remember as a boy, there would be somebody, with a limp or a withered arm, and my mother would say, I say, "Mom, what happened?"
She had polio, yeah. Oh, yeah.
Yeah. And so the polio vaccine, we've practically wiped out polio. You have an obligation to take a polio vaccine. You do. You have that obligation. Don't think and say it's been eradicated. People come from countries that still have polio.
Right.
And if you don't have the vaccine, you can get polio. Same things with measles and mumps and rubella. Folks, I'm pretty sure they used to call it German measles.
What was scarlet fever? Same thing?
No, scarlet fever attacked the heart,
Okay.
heart valves. I'm pretty sure about that. And that's still around. That's still around. But those vaccinations have helped greatly. And because of that, a lot of children have overcome and not even had the...
Have avoided it.
Yeah, they didn't get chicken pox. For instance, would pockmark a person's face. A severe case of chicken pox could pockmark a face. But the other one that has been a marvelous drug, a miracle vaccination, was smallpox.
Oh, yeah.
Yeah, smallpox.
Because that was a deadly disease.
Deadly. Even George Washington had smallpox.
Oh, really?
And his face was pockmarked because he had smallpox as a child. And then he insisted that they knew about vaccination. They would take some of the...
Is that true in Washington's day?
Yeah.
I had no idea.
Yeah, they would take some of the pustule and then prick it, I guess inject it in their own way into a person. And Washington knew it worked, and he wanted his troops all to be inoculated against smallpox.
Wow.
Yeah. So, you can go through so many of the diseases that have, really almost been eradicated because of vaccinations.
Yep.
A lot of schools, most schools, will have a protocol. To go to school, you have to show that you were vaccinated. Now, folks, as I said, the vaccinations that we have now, I say COVID is a different case because it was not given the testing that it should have, but a lot of these vaccinations that we require for children to have, or people going into the military, or whatever the case may be, they have been proven to work. And we have a lot of people now, she's not going to be vaccinated. My baby's not going to be vaccinated. Let me tell you something, folks. You're doing your child a disservice. And I'm going to have a whole bunch of people see after me now saying, oh, hell, you can't say that. I can say it.
Because it's true.
It's true. If you have a child that's not vaccinated and you take a trip, just let's say you could do it anywhere, take a trip to Miami, and there's measles in Miami. Well, your child is going to get the measles, maybe, but also the fact of the matter is that measles can spread, and they are spreading throughout the whole country, and they could do terrible, terrible damage to our society. Do most people survive measles? Yeah, most do survive measles, but you would rather not have measles. The other one was mumps.
Yep.
I had mumps, mumps like that. And most people survive mumps, except, what people fail to tell you, that mumps in a male child sometimes cause sterility.
Right.
So what are you playing with here? What are you proving? I don't know. I know we're going to get a whole bunch of mail saying, oh, you can't say that. I'm an anti-vaxxer and all this stuff. I think, Robert Kennedy is onto some good stuff, but I think some of the other stuff is a little bit extreme, although he seems to be moderating his view.
I think his boss told him to.
I think so, too.
Cool his jets.
Yeah, I think so, too. So, folks, face reality. These diseases, although they have been somewhat subdued, they're still around.
And as we're seeing with this little mumps issue, largely in Texas, it doesn't take long to spread.
No.
And I think, when you are in Houston or Miami, there are a lot of internationals arriving at your airport every hour.
Yep.
And some of them are not vaccinated. Some of them are carriers of various diseases that they may not even, they've developed some sort of immunity to it, but the rest of us haven't.
That's right.
And so it doesn't take much to set off an epidemic, and the way to solve that is vaccination.
Right. Especially, why set off an epidemic? Why have children sick if they don't have to be sick?
Right.
And when you talk about these vaccinations, people said, I was reading an article, I think it was in the New York Times, and the writer, editorial writer, says the churches should preach that people should be vaccinated. They have a moral obligation. And I'm not opposed to the church. As a matter of fact, the church should get involved in many of the social issues. And, perhaps that's one of them. You have a moral obligation, which is true. But the churches somewhat hurt themselves when they went gung-ho on COVID, telling people you have a moral obligation when the drug wasn't tested enough.
Right.
Okay? So, a lot of times, even church people, they take the government line, or they believe everything that the NIH tells them, and then they kind of ruin their own credibility with their people.
Which they have certainly done. We're going to take a break. We'll be back right after this. But for the moment, I'd like to talk to you about the expense of airing this program. Many people don't realize how expensive it is to produce this program and to get it on the air. Would you care to guess? It's about $3,000 per week. We think that's a reasonable expenditure, but obviously it's an expensive one. So we need to ask for your help. If you'll go to actionforlife.org and click on the donate button, it would be greatly appreciated. Now, you can donate once or you can donate each month, and we certainly have viewers who do both. We appreciate that. Please take time now to visit actionforlife.org and click on the donate button. Thank you so much for your support, and may God bless you always. Welcome back to A Conversation with Father Orsi. I'm BC Cloutier. We're talking about vaccines today, Father, and I hearken back to my time in the United States Navy. Mm-hmm. They didn't ask me if I wanted any vaccines. They didn't ask any of us. They just lined us up and started jabbing. And in those days, they talk about an assembly line. Mm-hmm. They had these hydraulic or air-powered guns.
Right.
And if you moved, it would cut you. But if you didn't move, it just inserted that serum or whatever it was into your skin. And I remember being like this. There's a guy over here going, boom! And then right behind it, a guy over here going, boom! So I don't know how many vaccinations we got, but it was probably everything that was on the market at that time. And, it was just standard procedure.
I think, in a situation like that, I think it's the right thing to do.
Well, on a ship,
Sure.
Everybody is really close together. And
it's an important thing that people are not contaminating each other. But, it's the same thing with the classroom that we talked about earlier. You send a child to school that is not vaccinated, and if the other children are not vaccinated, it's going to spread throughout the classroom. We saw the damage that COVID did because kids were not going to school.
Oh.
And you don't want to repeat the same thing now with measles or chicken pox or mumps or whatever else there is out there. So I think that parents have to take vaccination very seriously. And I hope that, their physicians, their doctors would encourage them to be vaccinated. Now, you do have people, and folks, I'm not making fun. I'm just trying to think this thing through. And if you have anything to say, tell BC. They say they are into natural medicine.
Yeah.
Okay. Which I think there's something to natural medicine too, except, well, with these contagious diseases, I don't know what natural medicine can do to ward these diseases away. So you're going to have to consult with your physician, and don't go to Dr. Quackenbush. If this guy that you're going to has a rattle in his hand and a bone in his nose, I don't think that the AMA is supportive of his practice.
I'm thinking about the COVID vaccine specifically. And this is, I have to say up front, this is not empirical evidence. This is anecdotal evidence. We, all of us, know a number of people that said, nope, I'm not getting the vaccine. I heard people say, I don't need it. People who said, on principle, I'm not getting it. I don't know, but anecdotally, I don't think the people that were vaccinated were not any less susceptible to COVID than the people who didn't take the vaccine.
Yeah, I know people.
That's the interesting thing.
I know people that got the vaccine, and a lot of time, boosters too, and they got the disease. So there's another example of where this COVID shot was. I think it was sui generis unto itself, because, as I said, the safeguards were not there. You had Dr. Fauci, Dr. Bricks. What was her name? Dr. Bricks.
Oh, yeah, Deborah Bricks. Yeah.
And giving all kinds of information that they really didn't know themselves what they were saying. It sounded good. And then, when you have somebody like Fauci saying, I am the science. Well, whose science are you? I mean, science is supposed to be based on facts.
Well,
Whose facts are they?
He denied the Wuhan lab leak.
That's
and
right.
as it turns out, he was, we think, probably wrong about that. But if you remember, he planted his feet and said, no way that happened. It was somebody ate a bat at the public market.
They ate a bat. do you think we have bats in our head? First he says, well, you can't say it came from a Wuhan laboratory. Well, we're finding out now it did. They were fooling around with something called gain of function,
right,
to see if they could hype. That's the best way I can explain this. To hype the COVID virus,
I guess,
and, and therefore it became more powerful. Gain of function, and then it did escape. It escaped, and so we have a worldwide epidemic. Now, my opinion, the cure was worse than the disease.
No doubt about it.
Okay. However, we talked about other diseases, and we do have, as I said, we do have vaccines that have prevented is a better term, prevented these diseases from proliferating, and in many cases came to an end. The caveat also, as I said to you, though, is we also have to respect the individual person. And just like the doctors I talked about earlier said, well, we've had the virus, we have the antibodies, we don't have to be vaccinated. And their colleagues said, oh, yes, you do, you can't work at the hospital. That really is something that really limits a doctor's freedom, and it's making it out to be this is a political thing. This is not a medical issue anymore.
How foolhardy was it when there was such demand on the hospitals that they would keep doctors and nurses out of hospitals?
Yeah.
That doesn't even pass the common sense test.
And then some of the things that people wanted to use to combat the disease, hydroxychloroquine, and there was something, recidivir.
Oh, yeah, recidivir. I forgot about that.
I think I'm saying it right. But some of the hospitals would not even let a doctor, just say it was a doctor, bring that in to one of their patients. Well, if somebody is dying and they're having respiratory failure, and they say, oh, get more respirators. Well, the respirators were doing more harm than good.
Which they proved pretty quickly, didn't they?
Yeah.
Now, by the way, I also read something, and again, I want to offer the disclaimer. I read everything these days with the jaundiced eye,
yeah.
But you have to use some common sense. I read that, if you recall, Sweden was looking for herd immunity.
Right.
They didn't do what we did. I guess the vaccine was available, but no social distancing, et cetera. On a per capita basis, Sweden was more successful than America.
I think the same. Didn't Denmark do the same thing?
I think that's right. The Scandinavian countries went in that direction. Yeah.
Right. And they had a very good record on saving.
They had some people die, but on a per capita basis, without vaccinating people, they were more successful than we were.
Yeah, and there's something to be said about herd immunity. There's something to be said about that, where we build up natural antibodies toward diseases. But let's face it, folks. I I'd rather have not have a disease than have to build up antibodies against the disease. Just, let's face it. I mean,
I guess that's true, although I've always wanted to sit with an immunologist and say, people are so afraid of germs today. Mm-hmm. Is that hurting our natural immunity? When you were a kid, you drop something on the floor, your mother says, pick it up, blow on it, it's fine.
No, kiss it up to God.
There you go. Okay, same thing.
The only thing I wouldn't do that with was chewing gum.
Yeah, well, I get it, yeah. But, we were less concerned with those kinds of germs in those days. Today, oh my gosh, put some stuff on your hands, and I wonder if that isn't weakening our immunity.
They say that it does, because we don't build up a natural immunity because we're killing all the microbes, and some of those microbes aren't too bad. I mean, they just they're not bad. They're just there. I mean, so folks, you got to use a little common sense in all of this stuff. But as I said, really think seriously. If you're thinking of not vaccinating your child, think very seriously about that. Consult with your doctor, because it ain't no fun getting measles, mumps, rubella.
Even after all these years, I remember that.
Yeah.
We're going to take a quick break, and then we'll be right back.
Hi, folks. Over the weeks, you have become more and more familiar with our program, Conversations with Father Orsi. I know that you are enjoying the programs because you tell me that you do. I want you to be sure that you should never worry about missing an episode, because you can go to actionforlife.org and catch all of the episodes that we have produced over the last year. Now, also, extra added bonus, you can watch my homilies, my weekly homilies about the Sunday readings. That's also on actionforlife.org. Lastly, both of these adventures, conversations and the homilies, they cost money. And I'm going to have to ask you if you can help us out, because so many of you tell me how much you enjoy the program. Some people tell me our Sunday wouldn't be the same. We record the program, we watch them during the week. This is an expensive enterprise, and we think it's an important way to get out the gospel message and to talk about those issues of the day that are important to us as Christians. So please go to your website, actionforlife.org. There is a button you can click for donations, and please be generous to us to keep this show on the air. Your Sundays will not be the same without it.
Welcome back to A Conversation with Father Orsi. I'm BC Cloutier. I would add, before we get back to the conversation, Father, that we're being hosted today by the Centerpoint Community Church. Lovely facility, lovely people, and we want to give a shout out to them. Also, the Naples Summit for Life will be here at Centerpoint from April 23rd through 25th.
23 to 25, Wednesday, Thursday, Friday.
And if you want information about that, actionforlife.org. It's on the website, and there's an opportunity to attend. A lot of interesting seminars going on in those 3 days.
Yeah, some speakers that are well worth hearing, coming right here. And then the most well worth part of the whole thing will be the keynote by moi, that's French, and Pastor Jim Wright of Centerpoint Church.
And that'll be great. Yeah. So please, actionforlife.org. Final thoughts on vaccines and what we should be doing or not doing?
Yeah, what we should be doing. First of all, I want you to be able to say, respect science. Science is wonderful, and a lot of us are blessed because of what science has been able to do, especially with the field of medicine. Oh my gosh, what we're able to do because of scientists and doctors and nurses, all these healthcare professionals. Once again, like anything else, science can be very, very good if it's in the right hands, and if the alleged remedies work. We've been very blessed. We talked about vaccines. In many instances, they have improved our lives immensely. And we should not say, I'm not going to take a vaccine because I don't believe in it. Well, the proof is in the pudding. If there is a decrease, as a matter of fact, almost an elimination of polio, say, or measles, or mumps, or chicken pox, the vaccine works. If you have some suspicions about the COVID, well, you have a right to that. And as a matter of fact, I think that probably
A lot of us do.
a lot of us do. So I would be very careful as to what you take and what you don't take. Go to your doctor. Your doctor is a professional. I went to my doctor, and he's a good friend of mine, and I said to him, "What do you think? Should I take this booster for the COVID?" And he said to me, "My mother isn't taking it." Thanks, Paul. But and that's true. Your doctor can steer you correctly. Most of the doctors, they're wonderful people. They have a lot of experience. They know what works, what don't work, and they should be able to know you. So don't make the decision all on your own because you read it someplace, or because some friend of yours said so.
Yeah.
I mean, that's right. Yeah. Well, my friend said, "Well, who's your friend? Where is he or she getting the information that they're passing on to you?" You don't want to play with the lives of your children and with other people's children. I think there is a moral obligation to take the vaccines that have been tested over time. If something is experimental, well, then you have to make that judgment for yourself, and you should be supported in that judgment by the medical association and by the churches and by the government that you have a right, because you have the dignity of a human being to say no if you think something is not going to be good for you or for your family. So I think COVID's made us wise in many ways. I mean, it hurt. It's done a lot of damage, but it's given us a chance to reevaluate things. And I'm not 100%, behind Robert F. Kennedy Jr., but I think he has a lot of important things to say. And I think we have to pay attention to him. He's looking at it from another angle, and maybe it's about time we look at it differently and see how we're going to move on in the future in our healthcare system.
If Bobby gets rid of all the chemicals in food, he's my guy, because there's too much of that stuff going on.
But I love red M&Ms.
Thank you so much for joining us. That's it for this week. We'll be back next week, same time, same place. Until then, I'm BC Cloutier, wishing you a terrific week, and God bless.